Hello and welcome to My Body, My Rules. I'm Dr. Darren and this is Dr. Goodrin, and we're from the Mulock and Young Chiropractic Health and Wellness Center. Today we're going to talk about Dr. Google. So Goodrin, I have a headache.
Okay.
Let's see why I might have a headache.
Okay.
So how many results are there?
Only 274 million results.
Awesome! 274 million results to confuse you.
But let's go to this very reputable.
Yes, we're going to go to a reputable website. Now, we must understand that the internet, while Goodrin's looking up this site, that the internet is not peer-reviewed, it is not refereed, and it truly is the wild, wild west. So anybody can say anything they want, but we're going to go to a reputable site. So Goodrin, why could I possibly have a headache?
Well, it says here it could be a cluster headache, a migraine with aura, a tension headache, could be trigeminal autonomic cephalgia. It might be just a chronic daily headache or a cough headache or an exercise headache. It could be caused by foods or alcohol, poor posture, skipped meals. It could be caused by stress. It might be from acute sinusitis, arterial tears, a blood clot. It could be a brain aneurysm, arteriovenous malformation. It could be a brain tumor.
Am I going to live?
I'm not sure.
Because my heart rate's going up.
We might be being poisoned by carbon monoxide right now.
Oh yeah?
Do you have a concussion?
I don't
Could
remember.
be dehydration, ear infection, encephalitis, brain inflammation, giant cell arteritis, glaucoma, hangover,
No.
high blood pressure, influenza, intracranial hematoma, meningitis, medications, monosodium glutamate, overuse of pain medication, panic attacks or panic disorder, post-concussion syndrome, pseudomotor cerebri, did I say that right? Stroke, toxoplasmosis, trigeminal neuralgia, I think I already said that one. External compression headache, ice cream headache.
Dairy or non-dairy?
It would definitely be dairy.
It would be, wouldn't it?
Yes.
I don't know. At this point in time, I may have all of them or none of them. And you see, this is the problem with Dr. Google, is we now have an increased heart rate. I think my blood pressure is elevated. I'm really concerned that I may not make it through today, and yet we're going to Google to try and find out how to manage our health when we've got very important symptoms that are present. All right?
It does say right at the bottom here,
Oh, but there is an exclamation mark. And what does it say?
work with your doctor or other healthcare professional for an accurate diagnosis.
The accurate diagnosis. Not from your neighbor, not from your friend, coworker, colleague, Google, or anybody else that has no formal training whatsoever. You want an accurate diagnosis because, as you can see, there are dozens and dozens of reasons why you could be having a headache. What
Yeah.
appears to be a really simple symptom as well.
If you choose one of the wrong diagnoses, then you're going to be spammed with all sorts of information on the treatment for that diagnosis. So you may have the wrong diagnoses, and then you're going to spend a lot of time chasing that diagnosis, and then you're going to be buying the treatments for the diagnoses that isn't even accurate. And you're probably going to lose a lot of time and money that way.
Right, which leads to frustration and then leads to skepticism, right? Because then you're not really sure what to do because you really haven't been formally diagnosed properly anyway. And you're trying to save time or money, which when you go through this, by the time you search through all this, you could already have your initial evaluation done by a health practitioner.
And most of the time, the reason everybody is confused by the internet is because people who have very strong opinions, oftentimes they're saying, you don't have this, you have this, because they want to sell their program or their book or whatever it is. So we end up in a situation where we just don't trust anybody because everybody's trying to sell us something.
Yes, and I think I found that in my 26 years of practice, that the last 10 to 15 years, there's definitely a lot more skepticism, or people that are appearing to be more knowledgeable in what their symptoms are, but yet they still haven't had a proper diagnosis. And then, like you said, they get skeptical. It's like, well, is this really going to work? Because I tried a whole bunch of other things and they didn't work either.
Right.
But have you really been properly diagnosed? And that's what we're really focusing on here today, is get the proper diagnosis. Don't rely on Dr. Google, and don't start looking at a whole bunch of different things on the internet, because that's where paralysis with analysis occurs, right? And that's going to be actually one of our future topics, is what happens when you start looking at a lot of these different sites and reviewing 274 million results and really trying to figure out what you're going to do when time is passing by. All right, so thanks for watching, subscribe, and we'll talk to you next time.